Hello, I'm Atul Gawande. I'm a surgeon. I'm a public health researcher, professor, and director at Ariadne Labs, a joint innovation in Boston at Brigham and Women's Hospital and Harvard School of Public Health. Welcome to our event on securing resilient health systems to fight epidemics and ensure lives. Many thanks to our hosts, Chancellor Angela Merkel of Germany, President John Dramani Mahama of Ghana, Prime Minister Erna Solberg of Norway, for organizing this very important event and effort. I want to begin just by pointing out that we as human beings are made up of 13 organ systems. And we have discovered in the last century that there are 60,000 different ways those organ systems can fail. 60,000 different diagnoses and conditions that human beings can lead to our own demise. For those conditions, we have generated 4,000 different medical and surgical procedures, 6,000 different medications, and an uncounted number, but it's certainly in the thousands, of methods and approaches that are effective in preventing those problems in the first place. Our job in global health is to deploy that capability town by town to every person alive. It is, I would argue, humankind's most ambitious endeavor. It is extraordinarily daunting, and for the past decades we found some success by attacking it by disease, vaccine campaigns, HIV/AIDS treatment, etc. And it's had powerful effects. But Ebola uncovered what happens when people lack a sound health system and public health system that they can turn to. Such systems have a foundation of primary health care that people can rely on for the majority of their medical needs and as a sentinel for the public health needs, as well as a basic infrastructure of hospital and surgical care for essential and emergency needs. Without that basis, a horrifying disease can burn out of control and damage entire societies and economies. We know that the next pandemic can be far worse than what we've seen. And investment in building stronger health systems has proven to be among the most valuable investments a country can make, returning manyfold in economic growth, well-being of a population, and relief of suffering. We have an extraordinary lineup of world leaders this hour who responded to the Ebola epidemic and are joining together to push our health system strengthening agenda up the global priority list and announce a roadmap for strengthening global health systems and the new Primary Healthcare Performance Initiative. To start, I'd like to introduce Prime Minister Solberg, a global health champion for action on health systems. Prime Minister Solberg.
Excellencies, distinguished guests, ladies and gentlemen, it's a great honor for me to give this introductory keynote speech today as one of the conveners of the high-level panel on the global response to a health crisis. First of all, I would like to thank Chancellor Merkel and President Mahama for close cooperation in the run-up to this meeting. I would also like to thank President Kikwete for agreeing to be chair of the high-level panel. And I'm delighted that the panel has such highly respected and competent members. Many of you here today have played a key role in the response to the Ebola outbreak. We are now about to embark on a new and ambitious development agenda for the next 15 years. Health and education are vital if we are going to create prosperous societies that are resilient to shocks, and that we have the capacity to recover swiftly if a crisis strikes. As you will hear many days today, the Ebola crisis was a major wake-up call for us all. It was a stark reminder that the lack of effective health care is a daily and a potential life-threatening challenge for millions of people. In addition, the Ebola outbreak has shown us that future epidemics and pandemics have the potential of seriously undermining our new development agenda and our global health security unless we act now. In the past few months, we have received valuable inputs and useful pointers for our discussions here today from Chancellor Merkel, Secretary General Ban Ki-moon, and Bill Gates. The report presented in July by the Ebola Interim Assessment Panel, which reviewed WHO's response to the Ebola outbreak, is also highly relevant. Firstly, our goal is to build resilient, trusted and knowledge-based health services that are accessible to people in their communities. These community health services, in turn, must be supported by regional and national services to ensure that they have the necessary surveillance and response capability. Secondly, we need a rapidly deployable global health emergency response capacity to support local efforts during a crisis. Thirdly, we need to align global governance structures in international health more closely with those of the humanitarian system. Fourthly, we all know that there is a serious lack of vaccines, medicines, and diagnostic tools to address outbreaks such as Ebola. In this context, let us learn from our positive experience. The recent Ebola vaccine trial may be able to serve as a model for testing a vaccine's effectiveness during an ongoing epidemic. And last but not least, we need to mobilize the necessary domestic and international financial resources. We look forward to the high-level panel's report at the end of the year. It will serve as our main platform for action in the time ahead. And I will assure you all that Norway will continue to give priority to this work. And we look forward to continuing our excellent cooperation with our partners in this room and beyond. Thank you.
Thank you, Prime Minister Solberg. As she mentioned, the UN Secretary General Ban Ki-moon established a high-level panel on the global response to health crises to review the lessons learned from the Ebola outbreak. And we are very happy to have the chair of this important panel, President Jakaya Mrisho Kikwete, here to speak from Tanzania and brief us on the panel's work and insights. Welcome, President Kikwete.
Well, thank you, Professor. First, thank you, Chancellor Merkel, President Mahama, and Prime Minister for organizing this event. My only problem is we have not finished our work. So we've just started. We had 4 meetings. The first meeting we held here was really to understand the terms of reference, and then we did a lot of listening, a wide range of people and institutions, the academia, Medicine Sans Frontières, and so many players. And then we had another meeting in Geneva where we held lengthy discussions with the WHO fraternity and the various sectors within the WHO, the many players within the WHO. Of course, we also listened to other players. And then our team held field visits to Liberia, Sierra Leone, and Guinea to get first-hand experience and information about what actually transpired. And in that case, what was at issue to an epidemic that ended up killing so many people at a very short period of time. Getting 11,000 people dead in a period of 4 months, that was scary. And if it had continued at that pace, then you could see how many more could perish. And of course, we held another meeting here before the General Assembly, where we again met some other people, heard from other people. But we are beginning to now synthesize what we have actually collected, and so that in preparation for writing our report, in November we go to Germany for the G7 health ministers. We probably listen from them. And then we were listening from views of many. What I can simply say briefly is, what is it that we have observed so far? One, this is an epidemic that unfortunately happened in weak economies and weak health systems. There are not as many health delivery centers. There aren't as many health professionals. On the average in these countries, one doctor is for 10,000 people. In the US, 243 doctors for 100,000 people. So you can see the difference that way. The health workers do not have as much knowledge of the disease. The people do not have knowledge of the disease. So from the people affected, there wasn't much precautions. And when it's your child who is sick, the motherly love, the parental love, the relative love, they will be close to this child or a relative. In the process, people get infected. We've been told of health workers collecting patients in ambulances with no protection at all. So in the process, of course, in hospitals, taking care of the patients without the necessary precautions, there's that over 500 health workers died in the process of trying to save the lives of the sick. And then, of course, so in this case, what our recommendations would be, I'm just thinking around. The first thing is, let's see how we can really help strengthen health systems in the developing countries. Because if an outbreak happens in a developing country, as we've seen with Ebola, it also affects people from third countries. We had fatalities in the US, we have fatalities in Spain, which means nobody can be spared in the event. So our recommendation would be around how do we strengthen health systems, particularly in those countries that are developing, poor. That's one set of recommendations that we're looking at. But again, we looked at the regional response, the global response, the WHO, the systems from the regional health centers to the headquarters. We spoke to the co-directors, the regional directors of WHO. So it's for us, this would constitute another set of recommendations. How, in the event of an epidemic breaking out, how would the regional offices link with the country, the national governments, and how would they link with the headquarters of WHO. We are still looking at we also had discussions with Margaret Chan, Dr. Margaret Chan, on the WHO itself. It has this responsibility, fine, of declaring a public health emergency of international concern. What happens thereafter? Is the WHO's role just to declare public health of international concern? But if you ask WHO to intervene, are the structures built for that kind of work within the WHO? Maybe not. Because WHO doesn't have the doctors, the nurses, to be able to call, now there is an emergency in Liberia, go there. The WHO thus declares it's a public health emergency of international concern, in the hope that there will be some kind people somewhere who would go and send doctors, send the vaccines, send the medicines. So we also, it's one of the things that is really come out. Of course, the bilaterals after WHO on the 2nd of August declared a public health concern of international, a public health emergency of international concern. There was a lot of response now by the bilaterals. Many countries, Norway, Germany was one of the leaders, the United States, a number of international organizations also helped, and this is what really made it possible to control the disease. But the issues here are, which is we're still also discussing, how best can we do it? How, do we have to wait until WHO says? Or there could be a mechanism where everybody else involved can get information, and so that they would be able to respond. Of course, there was the issue of vaccines and medicines. Here is a disease that there was no vaccine, there is no cure for it. The issues we've been discussing is that this disease was first detected in 1976 in the Congo, in a village near a river called Ebola. That's why they gave the disease the name Ebola. Ebola is a river. But from 1976 until the outbreak in West Africa, killing so many people, vaccines not there, medicines are not there. What are you guys in the researchers doing, Professor? Why have you taken so long? So long to respond to this disease? It has come to a point where all of us are just helpless. The only issue here concern is palliative care. How do you help this one so that if he or she dies in a manner that is dignified? But otherwise, there isn't much that you can do. So there is a set of issues that we are still working on. As I said, it's work in progress. Well, that's what I can say so far. So much.
Thank you, President Kikwete, for that briefing. I think it highlights we have the Ebola as an example of being able to have emergency response and deployment. But then he pointed out that it all rests on the bed of fragile health systems. And while there are many concrete directions we're starting to formulate around deployment of better resources for the emergency response, we're only just now beginning to describe the story of strengthening health systems. I'd like to ask the first panel to come up, and we're going to then try to dig in deeper on the health system side, because in some way that dialogue has not been deepened to where we need to take it. Health systems have been recognized as being key to preventing and then fighting epidemics and to ensure a healthy life for all. It's a Sustainable Development Goal 3. But what is the pathway to the sounder health systems with less fragility along the way? Our first panel is on the state's primary responsibility, the national government's primary responsibility for strong and resilient health systems. To moderate and introduce our panel, I'd like to welcome Jasmine Whitbread, CEO of Save the Children.
Thank you very much. Your Excellencies, Chancellor Merkel, Prime Minister Solberg, and President, thank you very much for co-hosting this very important discussion on what I'm sure we can all agree is a critical issue, the challenge of building health systems in a way that will reach every person, no matter who they are or where they live, so that they can survive and reach their full potential. Before we go on with the panel, I'm delighted to hand back to the facilitator for our special guest.
I would just like to note that we've been fortunate to have the time of UN Secretary General Ban Ki-moon to join us. He is on a brief and tight schedule, and so I'd like to welcome him. He's been spearheading the launch of the Sustainable Development Goals this week, and as we talk about the strengthening of healthcare systems, he had a message that he wanted to bring to us about what we can do. So thank you for making the time, UN Secretary General.
Thank you very much. I'm afraid that I'm disrupting your dialogue. Thank you for your very kind understanding. Your Excellency, Chancellor Angela Merkel of Germany, and Your Excellency John Dramani Mahama, President of Ghana, and Your Excellency Ms. Ellen Johnson Sirleaf, President of Liberia, and President Jakaya Mrisho Kikwete, President of Tanzania, Excellency, and Prime Minister, Your Excellency Erna Solberg, and Honorable Bill Gates and Melinda Bill Gates Foundation, Dr. Jim Yong Kim, World Bank, and Margaret Chan of WHO Director General. Distinguished guests, ladies and gentlemen, it's a great pleasure for me to take even brief participation here. As you know, my life at this time is like a grasshopper, you know. Wherever there is something, you know, I just hope and take it and leave, just jump from here and there. I hope you will understand. I'm a very courteous person, but sometimes I have to be a little bit discourteous, rude. I don't want to be seen as a rude man, but even though I may leave, please understand, I have a lot of things to do. Exactly 1 year ago, more than 500 people were being newly diagnosed with Ebola each week in Guinea, Liberia, and Sierra Leone. Today, Liberia has been declared free of Ebola transmission. New Ebola cases have declined dramatically in Guinea and Sierra Leone as a result of decisive leadership and strong and concerted efforts of international support, national actors, and all this, everybody is on board. These developments give us hope for the future, but we know we must remain vigilant and ready to respond to renewed outbreaks. We must continue to work in solidarity with Ebola-affected countries during their recovery, as we have done during the Ebola response. And we must do better when next health crisis emerge. I'm grateful for the extraordinary support for the establishment of a high-level panel to examine the global response to health crisis by the leaders here today. And I'm particularly grateful to Chancellor Angela Merkel for her strong support and initiative. As you know, I appointed this panel in April and have been impressed by the urgency and seriousness with which it has worked. I look forward to his report at the end of this year, and I thank President Kikwete for your leadership and for your panel members. Excellencies, ladies and gentlemen, our human security depends on health security. We know the coming years will see unexpected new disease outbreaks. That is certain. We just do not know where, when, how they will strike us. Societies that proactively address these challenges and engage with their health systems in the response are at the heart of secure nations and a safer world. This requires predictable funding for accessible and effective health systems and predictable support when a health emergency is suspected. I am pleased by a number of regional and global initiatives to strengthen health systems. In June, G7 leaders pledged to strengthen health system under the leadership of G7 Chair Chancellor Angela Merkel and assist at least 60 countries with implementing the World Health Organization's international health regulations. I welcome the initiative to develop a roadmap for health system strengthening with clear thematic priorities. I also look forward to the outcome of the G7 Health Ministers meeting in October. The work of the World Bank has been pivotal throughout, including its efforts to develop a new pandemic emergency financing facility. In July, African Union health ministers adopted the Statute of the African Center for Disease Control and Prevention. It is also essential that the World Health Organization has the authority, resources, and capacity to provide global leadership in times of health crisis. I thank Dr. Margaret Chan for her critical efforts to reform WHO. Excellencies, ladies and gentlemen, the launch of the Sustainable Development Goals is a timely reminder of the critical need to build strong basic health systems and community resilience. Success depends on being able to anticipate these outbreaks, to react quickly, to curtail its spread, and to prevent the suffering. I'm confident that with the leadership here today and the various initiatives discussed, we will have the imagination and the political will to build a truly transformative and lasting global architecture for a healthy future. I thank you for your strong commitment. Thank you very much for this opportunity. Thank you.
I thank you, UN Secretary General, for the priority that you've given this work. I just have to say that there are several of us here who've been at this work of strengthening health systems and advocating for it for a good couple of decades. And the idea that we would have these leaders coming together in this moment and in this way to talk about systems is an extraordinary thing, all the way up to the UN Secretary General. So, Jasmine Whitbread, to now, what do we do?
Thank you very much. And as the Secretary General just reminded us, it's just barely 24 hours since the UN General Assembly adopted the Sustainable Development Goals. And those goals will no doubt have their critics as well as their fans, but I think we can all agree that the emphasis on universality and getting to zero is an important starting point for our discussion here on health systems. The third Sustainable Development Goal is on ensuring healthy lives, and it includes a target to reach universal health coverage. And while this target will require the combined efforts of many different actors, including business, civil society, international organizations, and can only be delivered in partnership with people on the ground, at the end of the day, the responsibility for attaining that ambition sits with states. And how states can rise to the challenge of building strong health systems that deliver strong health outcomes is what we're here to discuss today. And again, as previous speakers have reminded us, the recent Ebola epidemic showed us that where health systems are weak or absent, then an outbreak can easily escalate into an epidemic. And social and economic gains are then also eroded. But equally, we have seen very strong progress on the reduction of maternal and child deaths in many middle and low-income countries that have invested in health systems, ranging from Malawi to Ethiopia to Bolivia. So finally, I just really wanted to say how much Save the Children welcomes the launch today of the roadmap to build health systems and to signal our willingness to contribute in any way that we can. And so with that, I want to hand over to our distinguished panelists and allow me first to introduce them in turn, and then I will ask each of you a question to kick off your remarks. So first of all, our host, who's already been introduced, His Excellency President John Mahama of Ghana, and then obviously Dr. Margaret Chan, who's the Director General of the World Health Organization, and Mark Dybel, who's the Chief Executive of the Global Fund for HIV, TB and Malaria. So if I may, let me start first of all turning to you, President, and talking before about, and if you could maybe share with us, what were you able to do in Ghana to protect your country in the Ebola outbreak? And what lessons do you think can be taken from your investment, your long-term investment over the years in building health systems that could perhaps be applicable in other contexts?
With Ghana, I would say it was luck because we never got to test our national response to Ebola. The outbreak occurred in a very peculiar area of 3 countries, the junction of Liberia, Sierra Leone, and Guinea, where people share the same culture, the same language, and so it occurred just close to the border with each other, and then it spread into the 3 countries. Now, remember that these are countries that had long periods of civil war, and so their progress towards putting in resilient health systems had been interrupted for a very long time. And so there's a shortage of personnel, there's a shortage of facilities, there's a shortage of logistics and equipment, there's a shortage of medication, everything. And so naturally, I mean, the epidemic had the opportunity to spiral out of control. Other countries in West Africa have been a bit luckier. Long periods of stability in Ghana have given us the opportunity to build a relatively, I would not say perfect, but relatively more robust health system than was existing in the 3 countries. And so once the outbreak took place, we started to put in the national response. We trained, created the treatment centers and everything, but there was not a single case, and so we never had a chance to test it. So more so Mali and Nigeria and Senegal would be the ones that had the experience to have infections and had success in terms of, stopping the infection. Mali was a good case. Nigeria was a good case. A couple of health workers lost their lives. Almost 8 people lost their lives in Nigeria, but they were able to stop the disease. And so we need to learn the lessons of those countries and how they were able to do it. But on the question of building resilient health systems, I believe that one is for us to continue to invest, both at the national level and at the international level. And also to invest not just in terms of the quantity of funds we're putting in, but in how we can make every single dollar we put in more efficiently used than we're doing currently. In Ghana, we have a health budget of 8 billion Ghana cedis. 8 billion Ghana cedis is $1 billion a year. 1/3 of it goes to the national health insurance system. 1/3 of it goes to paying health workers. And another 1/3 goes to investing in facilities and other things. We need to make sure that of that $1 billion we're spending per year in Ghana, each dollar we're spending is being used efficiently. And I believe that World Health Organization and all helping us to audit performance. And that's why I'm happy about this primary healthcare performance, indicators, because we need to strike a balance between putting in the curative facilities, and at the same time investing in primary health care. Primary health care is important in identifying diseases in terms of providing health information to communities and making them aware of their health status, collecting, results from the local level and bringing them up to the national level so that we know what progress we're doing in terms of providing better health to our people. But in doing that, are we spending our money wisely? And we'll need assistance in Ghana to be able to do that. In Ghana, our basic health module is what we call the community-based health planning and services compound. And what we're trying to do, we're migrating from a system of health volunteers to the community-based health planning services compound, which we call the CHIPS compound for short. And so we're putting in these CHIPS compounds in the remotest of areas. We have identified at least 6,000 electoral areas in which we must put CHIPS compounds. And each of these CHIPS compounds has a nurse's quarters where we have a trained health personnel, either a nurse or a midwife or a physician assistant living in there, and one, providing health awareness to the community, and then two, treating little cases like malaria and so on and so forth. But more importantly, saving the lives of women, seeing mothers who are pregnant with a small V-scan equipment, being able to scan the mother and see whether this is going to be a difficult birth or not, and moving the mother quickly to a health facility, so that she can get the best of care and not lose her life when giving birth. So I do believe that we need to invest more, but make sure that we're spending our money more wisely and more efficiently than we probably have done in the past.
Fantastic. Lots of examples there, and I'm sure very relevant in other contexts. Maybe I can turn to you, Margaret, next in terms of what are the recommendations that the WHO is making to governments in terms of building strong and resilient? And maybe if I can add a follow-on question, what do you think are some of the lessons, not only from Ebola actually, but from the successes through the Millennium Development Goals, where we've seen countries like Ghana make investments?
First, let me thank Chancellor Merkel, Prime Minister Sovereign, and also President, your good self, for bringing us together and move us forward. Now, to answer your question, let me be honest with you. WHO Constitution is very clear. Provision of health to keep people healthy is responsibility of government. And in order to do that, you do need strong health system. I'll come back to that. What are the components of health system? But in situation, as you have heard from President, the Ebola-affected countries are post-war, post-conflict countries. It's a totally different ballgame when you talk about fragility, insecurity, and conflict. I mean, I want to commend the leadership of, President Sirleaf Johnson is here, and the other two presidents. They have tried their best under extremely difficult and trying conditions. I mean, that is one thing we need to recognize. Building a strong health system in fragile countries is different than that in the low-income, middle-income, and high-income countries. And what kind of a health systems are you talking about? So let me use one example. You only have a couple of hundred doctors in Liberia. In one hospital alone in New York, you have more than 5,000 doctors. I mean, when we talk about resilient, functioning health system, let's go back to basic. What are the basic minimum? Primary health care is affordable. It's not cheap, but it is affordable, and it is sustainable. There are important elements that we need to have in order to make them successful. We have seen successful examples in Bangladesh, in Rwanda, in Ethiopia. There's no lack of success. So what do we need? Number one, first and foremost, political leadership and commitment from the government at the highest level possible. As we have heard from President Ghana, you need health infrastructure. You need healthcare, community healthcare workers. You do need health information systems to collect data, disaggregated data, to show that, which age group, which sex is affected the most, so that you can target your intervention to get the maximum return on investment. And of course, you also need to have essential medicines. Prime Minister, Soban, you talk about, lack of, stock out. We are seeing serious problem now, even with the most basic medicines, not just in the South countries, even in USA. Why? Because there's no market incentive to make medicines that are not, are bringing in profit. So it is really much more complex than we think. But to have primary health care system is not good enough. There is a dichotomy in many countries. When they talk about primary health care system, it's only the components that treat maternal, newborn, child, and adolescent health, but not including the basic public health measures for disease surveillance, supported by laboratory, because without the surveillance and the laboratory, you cannot detect disease early. So you miss your early warning system. So another point I want to make. Partnership is extremely important with civil society, including your organization and many others. WHO, I was very happy to hear from President Kikwete. During Ebola outbreak, WHO was expected to build hospitals, to send doctors and nurses, and even got a call from a president. Can you give me how many doctors? I said, WHO does not control the world's doctors and hospitals. But anyways, that's something we need to learn the lessons. Partnership, private sector, civil society, academic. Data, I will leave it to Bill to talk about it. It's important. But last but not the least is financing. And I believe in domestic financing to be supported, by ODA, innovative financing, in situations where countries are not yet able to do so on their own. We must not leave countries behind. We must not leave people behind, especially in the context of sustainable development agenda. I want to finish on one point. 17 goals, 169 targets. How are governments going to grapple with that? We need good information so that we can make the right prioritization. We need good information so that we can measure and hold people to account. When I say people, including UN agencies and everybody who is promising to do this, that, and others, and give this, that, and others, whether they are walking their talk. Thank you.
Thank you very much. Thank you, Margaret. So, Mark, can I turn to you? And maybe you can talk a bit about how the Global Fund can help to build the surveillance and the response capacity of governments, and indeed how the fund has over the years started to have an element of its work, a strand running through it, really focusing on the building of strong health systems.
So thank you, and thank you to the Chancellor, Chancellor Merkel, Prime Minister Solberg, and President Mohammed for your leadership in calling us all together, and for your leadership and support not only in responding to emergencies, but a systematic approach to build resilient and sustainable systems for health. And I'll just make 2 quick points related to that. One is I was very intentional, systems for health. If the outcome we want is a system, we will get a system that might or might not provide health. If our outcome is health, we are likely to build a system that will provide it. So I think that's a very important point, a system for health. The second point I would make is surveillance is critical, but we're talking about data management, from the community healthcare worker that President Mohammed was talking about, to the local leaders, to the national leaders, to the global leaders. A good way to put it is if we were waiting to put out fires until a mayor or a governor or a head of state decided we should intervene, most cities would have burned down by now. We have to have first responders with data and decision making for what they're capable of doing and trained to do that, and then have a system of data management that allows you from every level to respond in an effective way. If we wait for a response to report, someone to make a decision and report back down, we will not tackle any emergent response, but we will also not provide quality health care. It's really the data and the data management at every level that will drive a system for health. And related to that, and hugely important, if we see a health system is ending at a clinic, we will fail. A former minister of health, and maybe he said this because he was a former, said, look, I wasn't a minister of health, I was a minister of public hospitals. If you don't get into the community, we will not have health. We'll have responses to issues. We will not have a response to HIV, tuberculosis, and malaria. We will not have a response that will get vaccines to the people in need. We will not get to that last mile. So let's think not about surveillance, but about data management systems and building what's necessary for that, and think about building those systems for health, and then we'll be able to support the countries. The Global Fund commits about a third of its resources to what anyone would call health systems, because you can't do this work if you don't build a health system. And HIV, I think, is a unique thing in that it was a chronic disease. So we had to support the building of a system to respond to a chronic disease, or you couldn't control the HIV. And without a community response, none of that would have happened. So collectively, what we need to do is come together, play our individual roles, but fit under the national policy and national approach to build those systems for health that reach into the community.
Thank you very much. Did you want to come back on that, President?
Yeah, and I just want to emphasize what Mark said in respect of gathering data and surveillance. It's critical. Whether it's a community health volunteer or it's a CHIPS compound or a trained personnel, we must establish a system of collecting data. Once you have a good system of collecting data, you can see, it's easy to see a variation if something is happening. I mean, there are a few more deaths than normal. It will show up in the data. And somebody will say, no, let's go investigate what's happening here. And there's something that's been happening in Africa that we can ride on. That is a telecom explosion. There are mobile phones in every community. There are more mobile phones than human beings in my country. And so if we train these community health workers, or volunteers, to have a simple GSM phone and be able to transmit data to the district level, and there's somebody collating that data and transmitting it to the national level, just looking at the data, we should be able to tell, no, there's something wrong happening in this. I mean, a number of people have died. It's not usual. What killed them? What happened? And then be able to trace back and see, what's happening. And so I think that what Mark said was important, but also to look at the plug-in of the success of vaccinations in Africa. We have fewer children dying today before the age of 5 because we're giving them immunization. Recently in my country, with the help of Global Fund and Gavi, we have started giving adolescent vaccinations for cervical cancer against HPV virus. 25% of all cancer deaths in Ghana are as a result of HPV. And so we must also look at that angle. And I'm happy that the Global Fund did a very successful replenishment. I've been an ambassador for Global Fund. I'm an ambassador for Gavi too. They also did a successful replenishment. And, that helps, in terms of reducing, in terms of primary health care and making people live a better life.
I'd love to give the panel more time, but I'm getting a signal here, and I know we've got some very eminent speakers we want to get to. So I'd just like to thank the panel for your optimism and promise to build on the experience of what works through the Millennium Development Goals into the Sustainable Development Goals, what we've learned with the Global Fund, the WHO, and to really get this agenda right. And if we get it right, then we can impact the lives of thousands, millions of people by 2030.
One sentence. You cannot manage what you cannot measure. Precisely what you said. Thank you.
Thank you.
That was tremendous. Thank you. I'd now like to introduce Bill Gates. As you know, he's the co-chair and trustee of the Bill and Melinda Gates Foundation that has invested in both responding to the Ebola epidemic, but provided long-time leadership around strengthening health systems, including more than a year ago, founding with Jim Kim and the World Bank, co-founding the Primary Healthcare Performance Initiative. He'll be speaking about the link between effective national health systems, data, and meeting the Sustainable Development Goals. Bill.
Well, thank you. Our hosts here, it's probably no surprise, are great champions of everything we're talking about. Chancellor Merkel hosted the Gavi replenishment, which was very successful. Prime Minister Solberg has been a great champion for global health, and particularly how we take the lessons from the Ebola crisis, move forward on that. And also, President Mohammed, as you heard, has been very involved as an ambassador for some of these campaigns. Seth Berkley and I had a chance to visit Ghana, and one of the interesting experiences there was to see them taking their data sheets and how seriously they would take the data and summarize it. And one of the places we went to, they were looking at the data and they realized that there was a clinic that had only been sent 100 vaccines, but they actually had vaccinated 102 people. So at first they thought, oh, these people are faking the data, there's a real problem here. So they went down and they investigated it, and turned out that if you have multi-dose vials, and if you're very, very careful about how you do the drops, you actually can vaccinate 102 people with 100 doses of vaccine. And they were just so skilled and careful with that scarce resource that, in fact, it turned out they had done a great job, so they weren't actually in trouble. But it speaks to the culture of data that the Ghana primary health care system is one of the exemplars, that they really care about it, and that data flows up, and really they see when something's not happening, and they dig into it. And that's really, I think, part of the theme of this event. As we've said, the SDGs are very ambitious in the area of health. They basically aim to cut childhood death in half again. We did it in 25 years, 1990 to 2015. We're trying to do it 2015 to 2030. The key thing that we could say, there's two key things that will be necessary to achieve that. One is that we not have some terrible epidemic that comes along and destroys the health system as it did in those three countries. And the second is that we build great primary health care systems, far better than we have today. If you care about malaria, TB, vaccination, getting tools of reproductive health out, any of those things, the primary way it's delivered is through this primary health care system. One of the amazing things we see is there's huge variance between primary health care systems in low and middle income countries. There's not a strong correlation between your level of wealth and the quality of your primary health care system. There's some countries that at very low levels of wealth actually do elements of primary health care very well. Tanzania, Ethiopia, Rwanda, Ghana, these are countries that, although they're not perfect, there are best practices in those countries that we need to spread to other countries. Nigeria is an example of a country who could benefit from those best practices. They spend as much on primary health care as the other countries, and yet because the system is not well organized in most of the country, they are not getting the results. And you can look at their childhood death rate, and it is much higher, even though their economy is very strong. So it's fantastic that we're meeting here on the beginning of the SDGs. We're not here talking about some complex science like inventing a new vaccine, but we are talking about something where the execution has to take place everywhere in the world. And so basic questions about the supply chain, about personnel showing up, if you need electricity, is the electricity there? Are they properly trained? Are they charging for things they're not supposed to charge for? Those are all things that we need really good data, not countrywide data, but literally primary healthcare center by primary healthcare center. It's almost like running a good retailer. These are things that you have to know to do things well. As was said, the digital revolution should give us a way of doing this without adding a lot of costs and a lot of overhead for those workers. In fact, we should be able to even reduce the amount of paperwork they have to do and get the data even faster in this day and age. So it's very exciting. Anybody who thinks there's some big debate between vertical versus horizontal, yes, there's some discussion about the optimization, but the horizontal piece is the most important piece here that's going to let us achieve that goal of cutting childhood death in half. When primary health care doesn't work, you get a breakdown that the mother who's come a long distance to bring their child there sees that they're not getting what they need, and next time they don't make the effort to come in. So you have to have high quality supply of primary health care, and then you have to make sure that the population is educated. If you come back and fix a system, you really need to let people know, because that's a big investment on their part to come in, and you've got to make sure they're having good experiences when they do that. Today we're launching a new partnership to have these measurements, to have them on a regular basis, and to really track the components that go into a great primary healthcare system. The basic things like, is the supply chain working? This is called the Primary Healthcare Performance Initiative, PHCPI, and it's a partnership between our foundation, the World Bank, and WHO, and this is going to come up with these vital signs. It's called the PHC Vital Signs Scorecard. The data will be very up to date and actually on a website in real time, and you're going to hear quite a bit more about that from this next panel. So it's a great initiative. So thank you to our hosts for giving us this opportunity.
Thank you, Bill Gates. I'd like to welcome our panelists to the stage now. President Ellen Johnson Sirleaf of Liberia, Dr. Tim Evans, Senior Director for Health, Nutrition, and Population Global Practice at the World Bank Group, Dr. Seth Berkley, CEO of Gavi, the Vaccine Alliance. And we'll be talking a little bit about the primary health care initiative and the effort to create tracking and catalyzing of improvement in primary health care. I'd like to start with President Johnson Sirleaf. First of all, congratulations on being declared Ebola-free this month. This is huge. Today, with the launch of the PHCPI, we're providing the first key data for leaders on the condition of primary health care country by country. And as Bill Gates mentioned, there's wide variation. Before Ebola, in Liberia, 47% of women lacked access to primary care just due to cost alone, and the signs are now, with the death of 192 health workers, that access has undoubtedly worsened. So as you are trying to put the Ebola crisis behind you, and it never is quite behind you, why is primary health care important in Liberia? And you'll have a microphone here.
Let me first, put the historical part in context. As a country coming out of 2 decades of war, scarce resources and massive destruction, this meant that we had to respond to the needs in every sector. We did try to identify areas where the country was much in need, and for example, child mortality, maternal mortality were areas where we had the worst record in that regard. And so, in trying to rebuild that health system, we put focus on that, on HIV/AIDS. We also recognize malaria as being one of our greatest areas of need, and so again, we try to make sure that we improved our performance in those areas. But we also know what happened, that when Ebola hit, it was a wake-up call for us because we knew then our healthcare system did not have the proper responses because of the lack of doctors, not enough of them. That's already been mentioned. The fact that nurses were poorly trained and poorly paid, and we didn't have enough facilities over the country for a country that has a major deficit in infrastructure, such as power and roads and telecommunication. And so primary care was clearly an area that, although we tried to meet these basic things, although, like I say, we made some success in child mortality, we were recognized as the one area in the MDGs that we did succeed in meeting the criteria. And so, but all of the other areas with our weak health system exposed so much by the Ebola. When Ebola hit, everything that we had tried to do probably got affected, it just went away. We couldn't outgrow everything to Ebola now. What do we do in the case of trying to rebuild, having now been declared Ebola free? What do we do about our primary health care system? The first thing we thought about was trying to make sure that we regain the success we had in reducing the level of those affected by malaria. And so we went back to giving nets. And so nets have been distributed to over 1 million people. Also because the whole Ebola experience made people afraid. Doctors were afraid to do vaccinations anymore. So the education of getting them back the confidence, bringing back the confidence to start to do vaccinations. I think we were able, since Ebola, to vaccinate some 600,000 or so people. And so we recognize that what needs to be done is primary care. Our post-Ebola strategy is, first of all, to equip community volunteers, community workers with the basic knowledge that they have to be first responders, to be able to identify those who are suffering from a disease. And then by telephone, and I think President Mahama mentioned the whole thing, we haven't reached the CHIPS level where we have the specified areas of basic number of people, of healthcare workers to respond. But we do have the community workers. We're working with Professor Paul Farmer, who's helping to do that. We have a couple of people that Last Mile Help is another initiative that has reached one of our most rural areas. Those are the areas where we think are going to provide us with that until we can rebuild, again, the institutional system of trying to get help by getting information to referral areas is something that will take us some time to build. But we're trying to start at the community level and then move backward until we get to the tertiary level that are the main hospitals in the urban centers. But we realize that if we really want to do it, we have to use our Ebola experience, where communities were the ones that took charge, that took responsibility, were the ones that owned the whole process. And with them, we were able to get the success that we have today to be Ebola free. So we'll start where the success is, with community, and then build back. Getting data, we also know that's very important to have that information. And being able to have, I remember in our malaria case, President Kikitu will remember when he headed the ALMA, the African era, that we had the scorecards. And those scorecards are still with us today. Maybe we are going to start some scorecards in primary health care, where we can get people to see what the community workers are doing and how successful they are, how they're transferring information to appropriate referral centers, and then see where we need to do more to be able to build it. But I do agree, primary health care is the number one place to start. And once you start there, then you can build up in other areas.
Many thanks. The challenge you're highlighting is directly tied to the strategy of the Primary Healthcare Initiative, which is the ability to have monitoring and targeting of goals and provide visibility into a part of our system that's really been invisible. Tim Evans, I thank you and Jim Kim for being co-founders of PHCPI and bringing a key insight, which is that there are 4 elements of primary health care that are invisible to leaders and to the people who need these services. We've called them the 4 C's, that people need to know they have a reliable place of first contact for their health needs. That's not an emergency room or a hospital. They need to have continuity. Do they know who they are over time? Do they have coordination of care, including to public health authorities when there's problems that are emerging, or into higher level care? And there's a comprehensive, meaning do you have some decent quality, some accuracy, and ability to care for the majority of people's healthcare needs? We sought to provide these first measures. And so, for example, a good system ensures 4 prenatal visits for a pregnant mother, all of the vaccine doses for a new baby, and then appropriate treatment for diarrhea under age 5, we found in the data low-income countries vary from delivering this continuity and quality from just under 10% getting it to people to over 85% getting it to people. So Tim, my question is to you is, how do we catalyze improvement based on using this sort of knowledge?
Great, Atul. Thanks very much. We're delighted to be part of this. I'm intimidated when we're talking about C's and less than 10% because that's what my report card looked like in high school. But that was certainly a stimulus for improvement. But I think that the opportunity is learning and in learning for improvement. And I think, for example, if the first C, contact, had been a defining characteristic of all of the health systems in the Ebola-affected countries, I am convinced, that's a C, that we would have had much earlier detection of this epidemic when that 2-year-old child in December fell ill with Ebola. So having that contact, which means community workers everywhere being skilled appropriately and having support, is absolutely fundamental, and that is why PHC is a linchpin of universal health coverage. So it can give us indications, this PHCPI, of where we need to focus, because if we ignore the front lines, we ignore it at our peril. But let's go to the top end, too, because what you see in places in the same country often is areas of very high performance across those 4 Cs. And when you look into those, for example, Bangladesh, where I've lived and worked, they have very good immunization coverage. And in fact, their immunization coverage went up from 74% to 90%. And that stimulated the question, why? And when people looked at that, it was a frontline worker in immunization who said, let's put mothers' cell phone numbers on the immunization records, because he had identified that some mothers weren't coming back for the 2nd and 3rd immunizations. And so that simple innovation on the front line got scaled and led to a 15% improvement in immunization coverage. Absolutely transformative in terms of good performance, but it came from within the system. So identifying where that intelligence is absolutely important. And why is this important? Because in the World Health Report 2010, the assessment was that we're about 40% inefficient in the financing of our health systems. So if we can find the 2% improvement by getting 102 out of 100, right, that's a 2%, right? And if we can get the 15% improvement, because we're looking and listening to those frontline workers and understanding their performance systematically, then we can do a lot to get much better value for money, and that's the best way to build trust and confidence in the health system.
Thank you, Tim. Seth Barkley, I'll ask you our last question, because you have had great success in being a driver of getting vaccines to more children, and it's been one of the great primary healthcare successes of the past decade. What are the lessons in how we have to think about data? See, when you go live onto the website, which is now live as of today, go to phcperformanceinitiative.org, and there are handouts in the back to show you where to go, is that there is data, but it's got lots of holes, and it's also it's being replenished once every 2 years. What did you have to do to achieve the successes?
Thanks for the question, and I'm honored to be here. First of all, let me tell you a dirty secret. Vaccines do not deliver themselves. So when we talk about vaccines, we're talking about a health system. There are 5 contacts for a child to be fully immunized or more, and, by the way, their mother and potentially other children and other members of the family that come to be seen. And the good news, as you implied, is today more children are immunized or fully immunized than ever before in history. So the tracer vaccine we use, which is a DPT3 containing vaccine, pentavalent usually, but We now have 86% of the world's children receiving that, and 81% in Gavi countries. So that's a big success. But of course that means that 14% of children are not receiving it, or 19 in the Gavi countries. And we need to work on having that outreach. And this is critical to the system. When Richard Sesabera was trying to rebuild the health system in Rwanda that so successfully is functioning now, he built it upon the back of the immunization system. And so I think that's part of the core structures. But as we think now, you know, it's interesting. If you ask the question, what is vital registration? What's the most common vital registration? It isn't birth certificate. It isn't death certificates. It isn't marriage certificates. It's a child health card that 95% of kids in the world have access to at one point. How are we linking that into this data revolution? So for us, in our next goal, and we had a very successful replenishment, thank you to some of the leaders, not only Angela Merkel, who hosted it, but Prime Minister Solberg. Many of the other leaders were champions there. We have the ability now to drive forward and try to immunize 300 million additional children and prevent 5 to 6 million more deaths. But the way we're going to have to do that now is to get subnational, because averages lie about everything. We need to understand where there is good coverage, where there's not good coverage, and where there's not good coverage, we need to go after trying to do that in a real-time loop, as Bill Gates and others have talked about. And by doing that, if we identify a place that is not being served, they're more likely to have health problems because they're not getting vaccines, they're not getting anything else. If you can reach out and put the health worker, put the supply chain, put the cold chain, and put the data system in, of course, we'll count it as success in vaccination, but that will be bringing the health system to that community, and that's what's going to be critical going forward.
Well, I thank you all. Health systems have been daunting, and I think we're learning something. And I think we're learning from examples like yours that how delivery actually works for people has been invisible. The job we have is to make the invisible visible with data, down to the details of even the subnational level. We're just at the beginning of that, and you will see that in the data that we have available. The existing data is concerning because there are very low levels of performance in pockets, but also inspiring because there are high levels of performance that can be seen too, but we don't know nearly enough. With that, I thank you all. It is now my great pleasure to introduce German Chancellor Angela Merkel, who is the co-host of this event. She's made health system strengthening a priority of her leadership for the G7. And she's been, with Prime Minister Solberg and President Mahama, a champion of action on healthcare systems in the wake of Ebola, and we're paving the way to be able to do that successfully. Chancellor Merkel.
I have to ask you to take your devices for translation. I will speak in German. Ja, Exzellenzen, meine Damen und Herren, ich möchte zum Abschluss erst einmal allen danken, die heute ihren Beitrag geleistet haben zu dieser Diskussion und möchte vielleicht noch einmal zusammenfassen, worum es gehen muss. Im Grunde um zwei Dinge. Das eine, wie kommen wir, wenn eine Krankheit auftritt, irgendwo auf der Welt, an die Information, wenn diese Krankheit eine Gefahr bedeutet, nicht nur für die nationale Ebene, sondern transnational oder global sich ausbreiten kann. Diese Informationen müssen möglichst schnell gegeben werden und sie müssen transparent weltweit verbreitet werden. Die zweite Frage ist dann, wenn wir eine solche Information erhalten,
we shouldn't sweep it under the carpet, we shouldn't be afraid of sharing it with others, but we ought to use it to build up a system and to actually, well, as Anna Solberg said, to press the button, and now we know what the world needs to do in order to avoid and prevent a spread of an epidemic. So what do we need? We first of all need national health systems, no matter where this happens in the world, We don't know, after all, where such a disease will break out. So we need very well-informed and resilient systems. We need, secondly, an organization such as the WHO, which receives the necessary information from national organizations. And these regional organizations, the regional offices of the WHO, need to be put under an obligation, or however you settle that, that they need to report immediately to the central authority, WHO, and then the WHO has to launch a process immediately, which means pressing that button. So third, what do we need? If we imagine the World Health Organization as the information center, it will have to check where are the best medical heads, the best medical minds and capacities. The WHO may not be in a position to do that. I think we ought to build up a network, an integrated network, as many countries all over the world have it, with experts in certain fields who will then be able to communicate very quickly, share information, share possible ways of going about addressing that problem. So secondly, we need a sort of reserve, a contingency rapid reaction force. We at some point in time called it White Helmet, as an analogy to the Blue Helmets, that we can send to those countries where the a disease has broken out, so that they are there, present on the ground, where we have an outbreak of such a disease. And we need the whole of the logistics, which we cannot obviously have in place all the time. We need companies that are ready to, for example, second capacity, give transport capacity, as the case may be. And we also need information systems that relay the relevant information to the people on the ground, but that also link up the rest of the world, the professionals in the rest of the world, so that people don't panic, so that there's not widespread fear, but there is an orderly process, as we know it from our contingency planning back home, where on a national basis we are doing such exercises. And this ought to be our objective, because we don't know whether it's going to be Ebola next time, or it's going to be an outbreak of the Spanish flu, or other diseases that spread even more quickly than Ebola. And I think that is a professional reaction to it and response to it. And I must say, what I've heard today from the expert encourages me that we are actually on a sound footing, that we need to build on that. We obviously then need financial resources. We need the necessary funding. The World Bank has very intelligent ideas, for example, insurance systems, so that the rest of the world is not in a catastrophe, that the vulnerable countries are not facing catastrophe when they have such an outbreak of that is overtaxing their systems. And once we have this in place and simulate such a practice, a test run, if you like, then I think we're very well equipped to weather such a crisis. There are so many of you who have chipped in. Thank you, Prime Minister Solberg. Thank you, President Mahama, for being ready to help with this, and President Kikwete. I wish you all the best in concluding your work. We're looking forward to your report, and I think you should spare no one. You should not be nice with us. Be critical, so that we can eradicate even the last of our weaknesses. Thank you.
I thank you for an extraordinary session. I want to try to tie the events together in a couple short sentences. I think we've learned that systems are the foundation of good health. The engine of systems are the people who work in them. And the fuel of those systems is information. We are only just now understanding this recipe. We're starting initiatives today that begin to respond to the fragility of systems after Ebola, but all systems around building primary health care. And I thank the extraordinary leadership of the people gathered here around the idea of producing information to fuel the success of the people who build our systems. I want to give an opportunity for, first of all, simply thanking you for your leadership. The second opportunity I want to give you is that the leaders can leave first, please. So you have your chance to go upstairs and meet with the press, and you'll be guided out the door. We'll allow them to pass through the back if that's all right. And then after our leaders have left, I'll invite everyone to a reception upstairs on the 3rd floor. On the way, I will ask you to stop just outside the elevators on the 3rd floor for a demonstration of the new Primary Healthcare Performance Initiative website with representatives of the Gates Foundation, the World Health Organization, and the World Bank. Many thanks for a very successful event.